I'm Mary Dominguez. I'm the Executive Director of Bridger Clinic, and I've been with the clinic for 12 years. We've been in Bozeman since 1972, and we are the only private nonprofit Title X family planning clinic in Montana. Bridger Clinic is extremely fortunate to have always had the resource of a health education department, if you will, currently staffed with two health educators who have probably close to 25 years combined experience.
My name is Laura Bench. I am one of the health educators at Bridger Clinic. We provide education in the clinic to individuals, to groups, to agencies, to people outside of the clinic, with the underlying goal of helping people understand their bodies and to make good choices that will carry them through into their life.
My name is Cindy Ballou. I'm a health educator at Bridger Clinic. I've been at Bridger Clinic for about 13 years now. So over the years, we've developed a number of different programs, and we touch on a number of different topics.
We have a variety of resources, both books, videos, and internet resources that we can help people find to be able to get the information they need.
We provide a considerable amount of information and education to our patients during their exam visits. That's really very important to me.
Breast and cervical health education, for example, or programs where they could get discounted care.
Women who are with intellectual and developmental disabilities, and the focus of that program, which is called Women Be Healthy, encourages women to learn more about the pelvic exam and Pap test and breast exams.
We've been able to offer menopause workshops for women who are struggling to manage further changes as their life progresses.
Another important part of our work at the clinic is to do outreach in the community. It consists of schools, other agencies, sometimes families will consult with us.
We can start with very young children by providing their parents an opportunity to come together to learn about that very important role of being a sexuality educator for their children. As children grow up, we provide puberty workshops for both girls and boys to learn about the changes.
Hi, I'm Danny, and I'm the head of school at Montessori Elementary School here in Bozeman. I think that talking about our bodies and talking about puberty and all of those things, I think it's really important to even start that as early as age 2, as early as they're talking.
With respect to youth education in particular, and being a parent of young boys and thinking about, well, what are some of the most important things to me with respect to a healthy view of sexuality, I just think that the key is sound information.
So Bridger Clinic was wonderful in creating a program that tailored to our specific parents and what they were actually looking for.
We have spent the last 3 years at the alternative school, which has a program for teenagers who are either pregnant or have had babies, and we've done a number of support activities for them. I think a lot of times people think of family planning and women's health as all about women, and we've really tried hard to include men, because men are these women's partners, and if they can look at family planning as being part of a team and making decisions together, I think it makes it so much more effective. Our peer education program is a very important part of our outreach, and it is teenagers who are very highly trained who teach their peers about prevention of pregnancy, prevention of sexually transmitted infections, how to make a decision about sex, how to communicate your decision about sex to a partner, how to talk to other teenagers, how to talk to your parents about sex, how to ask questions of adults, just have a comfort level around sex.
My name is Heidi, and I am a former patient at Bridger Clinic. I'm also a teacher at Bozeman High School. We have numerous peer educators at our inner schools doing educational programs in a way that I think is very fair, it's very objective, it is not intrusive.
I'm Eli, and I am a junior in high school, and I've been doing peer ed for 2 years.
And I'm Kate, and I'm a senior in high school, and I've been doing peer ed for 3 years.
I'm Sawyer, and I'm a sophomore in high school, and I've been doing peer ed for 2 years.
I think it's really important to have peer educators in the high school because a lot of people, like Eli was saying, have questions that they wouldn't ask an adult. And so if they have the opportunity to ask us, then that means maybe like one less pregnancy or one less STD, which is really important.
So coming together with other people who are concerned and wanting to act to prevent teen pregnancy in the future has been really rewarding for us.
Bridger Clinic is committed to providing reproductive and related health care in a setting which respects the dignity, well-being, and privacy of each individual. We also provide educational programs that enhance information and understanding about sexuality and reproductive health.